Thyroid gland. The thyroid gland's function is the production of thyroid hormones, and the thyroid hormones have multiple functions. They are for cell metabolism, they regulate growth and development, and helps maintain blood pressure and temperature as well as heart rate. So this right here is your thyroid gland. As you can see, it's a small gland located on the anterior aspect of your neck. There are different conditions affecting the thyroid gland. One of them is hyperthyroidism. The problem in hyperthyroidism is that the thyroid is overactive, so there's an overproduction of the thyroid hormones. The causes may include Graves' disease, which is an autoimmune condition causing hyperthyroidism or overproduction of thyroid, and sometimes thyroiditis or inflammation of the thyroid gland. Signs and symptoms of hyperthyroidism include weight loss, heat intolerance, tachycardia or fast heart rate, and sometimes it can also cause exophthalmos, or basically the bulging of the eyes anteriorly out of the orbit. So this is exophthalmos, or the bulging of the eyes, and this is commonly seen in patients with Graves' disease. Anyway, so going back on the hyperthyroidism symptoms, so when you look at this is what happens when we speed up or expedite the metabolism. So everything goes up. Blood pressure goes up, heart rate goes up, our metabolism goes up, right? So it's very fast, so we have difficulty gaining weight. Instead, we're losing weight, our muscles are wasting, and sometimes it can affect women's menstrual cycle. It can cause the hair to be fine. It can cause heat intolerance, so everything is hot. So just imagine that you're running really fast constantly. So that's what hyperthyroidism looks like. When patients have hyperthyroidism, we can put them on anti-thyroid agents. Anti-thyroid agents work by inhibiting the synthesis of thyroid hormones, therefore decreasing the thyroid hormone levels in the blood. So it does not affect existing hormones. The therapeutic effect, of course, will include decreasing in thyroid hormone levels. Indications: hyperactivity of the thyroid gland or hyperthyroidism. The way to know if a patient has hyperthyroidism is if their TSH is very low. So the thyroid stimulating hormone is very low. It has an opposite relationship. The TSH level and the thyroid level have opposite relationships. So if the thyroid levels are high, the TSH or thyroid stimulating hormone is down. Some precautions or contraindications include some of these drugs. So if a patient is taking amiodarone and digoxin and some anticoagulants. So why is that? If you recall, amiodarone is a potassium channel blocker. So what it does, it slows down the heart rate. And if we give an anti-thyroid medication, that can cause an even slowing of the current heart rate. So if we give both medications, it can cause a profound bradycardia. In addition, same thing with digoxin. So if we recall, digoxin can actually lower the heart rate. If we're giving anti-thyroid agents, it basically has a very similar effect. So it can actually increase that toxicity. It can increase the effect of digoxin. And lastly, oral anticoagulants. So if we give anti-thyroid agents with oral anticoagulants, that can cause an increase of activity or inhibition of vitamin K, therefore putting the patient more at risk for bleeding. Side effects include agranulocytosis, which is basically a dangerously low levels of neutrophil, which is a WBC or white blood cell. This can be life-threatening, and so it increases risk for infection. It can also cause pancytopenia. So pancytopenia is basically the depletion or deficiency of all three cellular levels of the blood, which are the red blood cells, white blood cells, and platelets. Another side effect include hepatitis or inflammation of the liver because it is hepatotoxic. So this drug is toxic to the liver, especially in large quantities. The medication that you have to remember is PTU or propylthiouracil. Hypothyroidism. So the problem in hypothyroidism is that there's an underproduction of thyroid hormones. So there's different causes for this disease. So sometimes it's caused by Hashimoto's disease, which is an autoimmune disorder of the thyroid gland. It can also be from a pituitary dysfunction, so there's no release of TSH, sometimes because of use of drugs such as amiodarone, because amiodarone can cause either hyperthyroidism or hypothyroidism. And in some occasions, it can be due to a thyroidectomy or removal of part of the thyroid, or a complete thyroidectomy, which is the removal of the whole thyroid gland. So as you can see here, this is the thyroid gland, and in Hashimoto's disease, the thyroid is enlarged and it becomes inflamed and underactive. So it doesn't mean that it's larger, it's producing more hormones. Sometimes when it gets enlarged like that, the function decreases, it produces less hormones. And this is a person that has hypothyroidism. There's cold intolerance, they're always cold. There's receding hairline, right? The thinning of the hair, facial and eyelid edema. Sometimes they have extreme fatigue. They're always tired. There's a slower speech, anorexia. Sometimes they can't eat. They have brittle nails and hair. So there's hair loss, dry skin, so their skin is coarse and scaly. Sometimes it causes muscle aches and weakness, constipation, changes in their menstrual cycle for females, late manifestations. When it's not treated, it can cause very abnormally low temperature, bradycardia or slowed heart rate, weight gain, decreased level of consciousness, thickened skin, and sometimes it can cause cardiac complications. So that's definitely very dangerous. So we need to make sure that we are able to recognize that and treat it. I myself suffer from hypothyroidism. So mine is secondary or due to the removal of my thyroid gland. And the reason for that is because of some nodules that were found a couple of months ago, and when they did the biopsy, they found that they were suspicious for cancer. So in order to make sure, just in case it's cancer, they had to remove it. And because Filipinos are at a higher risk for developing thyroid cancer, my doctor and I decided that it was better to remove the whole thyroid rather than just removing parts of the thyroid. So now, ever since the removal of my thyroid gland, now I am dependent on thyroid medications because I don't have the thyroid gland anymore, so I cannot produce thyroid hormone. So my thyroid gland is gone. Once your thyroid gland is gone, then you will have to be on thyroid medication for life. And it's very dangerous for patients to stop the medication abruptly. So thyroid agents, their mechanism of action include hormone replacement. They basically stimulate endogenous hormonal action. So they replace the thyroid hormone. So they act as the thyroid hormone. So the same way that the thyroid hormone will work, it's that same mechanism of action. So therapeutic effect, again, effects are similar to the endogenous thyroid hormone, and so it helps with metabolism, with growth, and indications include hypoactivity of the thyroid gland. Some precautions and contraindications, known drug allergy, any recent MI, because when you're on thyroid medication, it can stimulate the cardiovascular system, it can increase your heart rate, it can increase your blood pressure, increase your cardiac output, so it can make your heart work harder. And so if you recently had an MI, that's actually not good for your heart, right? You want your heart to kind of be more relaxed and not work as hard. And also another contraindication is adrenal insufficiency, because this can cause acute adrenal crisis or decrease in cortisol production, as well as hyperthyroidism. Obviously, if somebody has hyperthyroidism, we don't want to give them more thyroid hormones because their levels are already high to begin with. Side effects include rash, urticaria or hives, nausea, tachycardia, dysrhythmias, weight loss, and sometimes fever because of that increase in temperature. Drug examples, so the drugs that you have to remember is your levothyroxine or Synthroid. So levothyroxine is a thyroid agent. So it is used to treat hypothyroidism. Nursing actions, definitely ongoing assessment for therapeutic effects and adverse effects, as well as drug dosing based on the TSH level. So as I told you earlier, the TSH level can go up and down depending on the thyroid levels in your blood. And so if a patient is on thyroid medication, it is very important for them to follow up with their provider and have those blood work done in order to ensure that, one, that the medication is working, and 2, if there's any need to adjust that medication, then they base it on that TSH level. Also, a very important patient and family education. We need to educate our patients that once they're on a thyroid medication, they should not abruptly discontinue their thyroid medication, because that can actually lead to very negative consequences and they may actually end up in the hospital. So it is very important to let them know to never stop taking their thyroid medications, unless of course they were instructed by their provider.